We are going to talk about the AR1. As Gil mentioned and Gary mentioned before, this is a one-of-a-kind type of applicator. There are other balloon-type applicators, most notably for breast, the Mammocyte and the Contura device, and then the other breast device is the Savvy. In some ways, this takes the best of all those worlds and does things that none of those applicators could do in their particular site. As Gil mentioned, sort of the standard of care right now is related to surgery. The way brachytherapy is typically used right now in rectal treatment is to downstage. So they'll hit the tumor with a certain amount of dose, shrink that tumor to a certain extent, but then go in and do surgery, removing basically the entire rectum. This can be obviously clearly a devastating surgery and decision for a lot of people. You know, the risks that run when you're removing the lower third of the rectum or more, obviously very, very high. The current solution, the current device that's used for that is called the mold applicator. It is essentially a flexible silicone tube that's inserted into the rectum. It has 8 channels, and the iridium source will travel to that to a prescribed length. As Gil described, it will have a number of dwell positions, and the accumulation of the number of time for each of those dwells and the number of dwells will dictate how the dose is distributed. One of the ways that the mold, well, really truly the only way that the mold provides any protection of tissue is for a water standoff, and I'm not sure if you guys are familiar with what that is, but it's basically a sleeve that would fit over a portion of this applicator where water could be inserted into that sleeve, and it would distance the applicator from the opposing tissue. If any of this doesn't make sense to you, holler, and I'll slow down or go back and try and be a little more specific for you. The chief advantage of this device is its flexibility and the diameter. The AR1 is a more rigid device, and this is a more flexible device. So in patients with advanced disease, this may be an easier device to insert. But the disadvantages to this applicator is, one, that your catheters are brought too close to the surface to provide adequate sparing of healthy tissue. That becomes a treatment planning challenge. The contralateral side, the side where you don't have affected tissue, where you don't have a tumor, as I mentioned before, they're creating spacing with a water standoff. It is imprecise, and in its imprecision, it becomes a difficult thing to reproduce, where you're sliding this sleeve over the device, you're inserting this device, you're inflating to what should be a predictable amount, and you're hoping that everything is in the same place. It raises the question, if you're doing all of this, but removing the rectum after this, what is the purpose of it? Which kind of brings forth a new standard of brachytherapy, as Gil has described. The idea that in many patients, they have comorbidities, they have other reasons for not receiving, wanting that aggressive treatment. There may be age involved. The idea of HDR brachytherapy in the rectum as a primary therapy has really not been thoroughly investigated, and some of that has to do with the tools. So what we have now is a tool that is able to do that. The most important features of this device, I'm going to stop there for a second. You all have devices that are being shipped to you as we speak, and what I would like to do is, one, ask you to resist the temptation when you get the device to inflate it. I'd like to set up a call for next week and take you through the device while you have a device in your hand. But I thought, let's expose you to it now so you're familiar with it, and then we can talk about it in more detail when you actually have the device. The area that I want to focus on, and Gil touched upon this, and I want to go into it a little more as well, is the dual balloon construction. And in this image, you can see there's sort of an inner portion that's darker. The treatment catheters, the 8 treatment catheters are mounted to that. They're roughly 1 centimeter apart. That is a rigid balloon, and the idea is when inflated to a consistent fill volume with water, that you're going to have consistent spacing of those catheters, which is going to allow, for treatment planning purposes, reliable geometry for dose distribution from fraction to fraction. As Gil mentioned, the protocol that they're using at Sloan is a 3-fraction treatment delivered once weekly. Reproduction of that dose is a very important thing. You are targeting a tumor. Placement of this device, and there are features about the device that aid in very precise placement as well, but precise inflation of this device all of those factors together will lead to a reproducible level of reproducibility that other applicators don't have in this area of the body. The outer balloon is a very compliant balloon. It's very soft. It allows you to extend the rectum, pushing the contralateral side further away, protecting that healthy tissue from unnecessary exposure, which is a real hallmark of brachytherapy, that you're able to very specifically target a specific target area. The other important feature to the material used is the fact that Gil mentioned exophytic matter. Any sort of protruding tumor in the rectal wall will actually be able to push itself closer to the treatment catheters, allowing, again, in treatment planning, a more effective, a deeper penetration of source to the target tissue that you are looking to expose to radiation. The device has radio-opaque contrast markers. It was designed specifically to be visible under all visualization modalities, specifically MRI. Gil is going to show you some images. I'm not sure sort of the level of familiarity you guys have, but the difference between what you can see on CT and what you can see on MRI is almost literally night and day. The images on MRI allow for very, very specific contouring of tumors, and as a result of that very specific contouring, a very specific treatment plan delivered to an exacting target area. So the advantages for MRI in this part of the body are very, very clear, which again makes this device really unique out there. Sorry about that. The next 3 slides come almost verbatim from our marketing piece, which I will also be passing on to you guys soon. Everything about this device is about precision. The repeatability of this is crucial because, again, we're doing this over 3 different treatment fractions. So the idea of being able to do this on a consistent base from fraction to fraction is very important. The markers lead towards very precise placement from fraction to fraction. As I mentioned, the rigid inner balloon gives you a very specific, consistent geometry to the device, and then the recording of the fill volumes that are used in each fraction allow you to refill the balloon in a consistent, repeatable manner. We talk about this being optimal, and as I mentioned, sort of having this combination of features in the balloon really does that. The compliant outer balloon ensures separation of tissue as well as the ability to really optimally target the tumor matter that we're looking to attack. The non-compliant inner balloon, again, predictable geometry, and the ability to use this device under MRI really gives you the most specific ability to target tumors in the rectum. I'll be sending this to you guys as well, but I wanted you to get exposed to all this before seeing all this and just kind of muddling your heads with, you know, what you should be holding on to and what you shouldn't. The images that Gil pulled were from a poster, the first poster that we've had actually as a company that was at ABS, not this past year, but the year before. And I think after what Gil has said already, what I've shown you and what Gil will show you in the treatment planning area, I think reviewing this particular poster will kind of tie everything together. Again, I'd like to schedule the time next week when you all have your applicators in hand, and we can go through inflating the applicator. I think having it in hand and having sort of the theory behind you will really help to tie all of this together as well. The other piece I wanted to show you is a case study that we did. I believe this was the first patient we treated, but if it wasn't, it was the second patient. I want to draw your attention to, let's see, let me expand this a little bit, to this image in particular. The level of detail that we have in this image on MRI is really just phenomenal. But what this shows is, in this area where I'm moving the cursor a little bit, that is a highly, highly targeted treatment plan, and something that you would not be able to do, one, with another device, secondly, without the benefit of brachytherapy. And I hope as kind of, again, all of this comes together for you guys, you'll understand the benefit of brachy in this area and the importance of this device in potentially sparing patients from surgery, and the idea that brachytherapy at some point may be a primary treatment for rectal cancer.